Welcome to the Indiana Coalition Network's March webinar. Today we're going to be talking about harm reduction. My name is Katie Rice and I serve on the network's management team. So if you've been to previous webinars, you've seen my face. Before we get started, please make sure on your screen name to add the county that you serve or that your LCC is in. This way we can make sure we get your county counted and that we show that you've been represented in our numbers. Today we actually have two wonderful speakers that will be talking to you. The first is Courtney Sturgeon. She'll be speaking first. She is the Director of Education at Overdose Lifeline, joining the organization in 2015 after 20 years working with a global education company. Our second speaker is Travis Jester. He joins us as a person in recovery. They'll go ahead and speak. Courtney will speak and then Travis will. And then after that, please save your questions and we'll do a Q&A at the end. So Courtney, if you'd like to take it away.
Great. I'll go ahead and share my screen. Can everyone see that okay? Perfect. Yep. Perfect. So if you'd like, if you have a burning question, feel free to chat, send it in chat. That way you won't forget it and we can source that as well too. So today we're going to talk about harm reduction, and I'm just kind of curious if anyone wants to maybe toss up to the chat, when you think of harm reduction, what word or activity do you think of? You know, what one word when harm reduction comes to mind? And feel free to go ahead and share that. And as you're doing that, I'm going to go ahead and get started here. So Overdose Lifeline, you know, we're a nonprofit based in Indianapolis, but we serve the state of Indiana with partnerships in, I think our last count is about 87 counties. And we're also so fortunate that we have partners that are utilizing our learning and programming in 38 US states. So we learn a lot from those partnerships around the nation too. So today I want to pull forward some points on harm reduction that may be new, or maybe they're going to just provide us with another view. The material that I'm sourcing is from a 3-credit-hour harm reduction course that's available from Overdose Lifeline. It's an online course. So if you're interested, just reach out to me. I'd be more than happy to grant you access to that as a gift and free. So just don't hesitate to reach out if you want to go a little bit deeper. So in the broad sense of the word, you know, harm reduction includes every strategy which helps to reduce harm, including abstinence. You know, we have to kind of keep in mind that an attempt to force abstinence on everyone or forcing that perfect moderation on everyone is not realistic and may lead to greater harm. So the most effective strategy is to meet people where they're at and work with individuals on goals which they choose for themselves. So that's kind of at the crux of harm reduction. And if I look on the chat, I see, you know, justice, safety, care, some of those keywords from the group. So thanks for participating in that. You know, it's not a new philosophy. Harm reduction has been long implemented in like the public health world. So we can think of vaccinations as an example, or through legislation intended to make consumer products safer, like seatbelt laws, and the environment less polluted. So like clean air and water legislation. So what harm reduction does is it acknowledges that us human beings are going to be doing things that are both legal and illegal that causes harm, and therefore harm reduction is going to provide services and solutions to reduce that harm. So at the baseline, that's kind of what its purpose is. You know, few of these harm reduction efforts have ever been thought of as controversial, but the application of this philosophy to addictions has been controversial. And that is due in part to maybe our zero tolerance mentality towards substance use and our war on drugs or criminalization history in the United States. Something that might not be top of mind when we think of harm reduction is community. Integral to harm reduction is addressing the effect upon the community and applying harm reduction practices to reduce the harm and risk to the community. So we see that those efforts, are going to be strengthening public safety by preventing disease transmissions, and injury, reducing public nuisance, providing an entry point for people into services, including treatment, and developing meaningful partnerships between, between community groups, public health and safety groups, and business groups. So when we think of harm reduction, syringe service programs or naloxone may be top of mind, but harm reduction strategies are many, and they fall across 4 primary areas. The first is education, and so that's going to be providing information and knowledge as well as how to apply that knowledge. Also providing access to tools which may reduce harm, such as syringes, naloxone or risk reduction kits. And support, a key attribute of harm reduction is the concept of low threshold support that has minimum requirements for participation. So it's wide open for people to gain access to. It normally addresses basic health and social needs of people who use drugs, and then linking to services, which might include medical services such as HIV, Hep C testing and treatment, to SUD treatment and mental health. So something to keep in mind is we need all 4 areas to optimize the impact of services because they're all interconnected. So we can't just do one to have the type of results and success from harm reduction. Okay. So another concept I want to put forward today is that harm reduction is naturally aligned to traditional substance use continuum of care. So when we think of a recovery-oriented system of care, that's that connected network of community-based services and supports that's person-centered, right? And builds on the strengths and resiliency of individuals, families, and communities to achieve that recovery and improved health and wellness and quality of life for those at risk or those with alcohol and drug problems. So the SUD continuum of care includes, prevention, early intervention, treatment, continuing care and recovery. And we can see some of the services provided displayed here on the chart. So while one may think that harm reduction as naturally a part of this SUD continuum of care, it really does fit into the systems of care with harm reduction services and activities crossing all 4 areas of the continuum. So today in many communities, SUD continuum of care and harm reduction services are running in parallel, right? They're often disconnected, however, so therefore that provides us the opportunity to be connected, and that will then improve the quality of care and outcomes for those affected by SUD. Okay, so really there's a lot of synergy between the traditional SUD, continuum of care, and harm reduction services. And beyond that alignment, both are also person-centered and strength-based. Harm reduction incorporates a spectrum of evidence-based and evidence-informed strategies, from safer use to managed use to abstinence, to meet people who use drugs where they're at, as well as addressing conditions of use and along with the use itself. Harm reduction is person-centered. The person is involved in the decision-making and they are an active participant as well. One concept I want to bring forward is substance use management, which is a practice that does not require abstinence, but instead focuses on a range of options for improvements while still including abstinence as a possible self-selected outcome. So, well-managed drug use meets a person's needs while not causing harm to others or unnecessary harm to the person. The goal of some is any positive change while addressing issues related to drug use. So when substance use occurs on a continuum from no use to benign use to chaotic use, and with many points in between. And what we need to recognize is that harms can occur at any point and should be addressed regardless of where the person is in that continuum. Okay, so we're not going to wait until chaotic use occurs to provide services and support to reduce the harm. We're going to address it all along that continuum. Some additional thoughts is the continuum of substance use is not linear. A person can move back and forth within the continuum. It's not just a one-way path. So for example, starting at an experimental stage does not automatically lead to the other end of the continuum. And then people can also be at different points for different substances. Okay, different points for different substances. So this is important to acknowledge, there are multiple pathways to recovery. Example, some people may want to abstain from a substance that's problematic, but still use something that's social or something that helps them through regular use that's not chaotic. Okay. When we think of traditional notions of recovery, they do not always make space for this option, which can cause more challenges for the individual. And those challenges may, delay that person moving into recovery or even block them from moving towards recovery. We've probably have all maybe seen the stages of change model in the past. It's used in SUD treatment and across other disciplines. And it's really helpful to kind of break down that complex process of changing behavior into these 5 steps, right? So the first step is pre-contemplation. I'm not even thinking about making a change for anything in my life related to substance use. 2 is I'm contemplating, I'm considering the change. 3, I'm preparing. Maybe I'm starting to research and look up recovery services and support groups. When I'm preparing. Action, I'm committed and I'm beginning to change. And then the 5th stage is maintenance. Change has become integrated with life. So it's common that an individual can go through this process 3 or 4 times before they make it through the cycle of change. And a person can exit, such as, experience a setback or enter, re-engage at any point within the continuum. So they could, exit at contemplation, but then come back in at action, so it's not, I don't have to go through each step in order. In the traditional model of SUD treatment, recovery is achieved during the 5th stage, whereas in harm reduction, recovery begins at contemplation. So someone's in recovery when they're contemplating, again, kind of going back to that concept of recognizing any positive change. So recovery begins and supports are helping them through that. There's just a few myths that I wanted to pull forward. There's many with harm reduction, but I've pulled forward 3 here for us. The first one is harm reduction encourages people to use substances. There is a multitude of formal research that shows that harm reduction activities do not encourage substance use. In fact, they encourage people who use substances to start treatment. If we think of the baseline here, right? So harm reduction provides connection and support. It may be the only connection support that individual has is when they're going weekly to get some harm reduction services from an organization, their community. And we all know that connection and support is key to recovery as well, too. Another myth is that abstinence-based treatment models are not supported in harm reduction. So I talked about that a little bit so far, but of course they are supported. So while harm reduction approaches often serve as a bridge to treatment or cessation of drug use, these outcomes are not preconditions or the only goals. So what that means is someone can still be using drugs and start receiving services and benefits from harm reduction. It's not a precondition to receive those services. Harm reduction neither prescribes abstinence nor uses coercive tactics to elicit it, because such tactics may inadvertently cause more harm to that person. And then finally, harm reduction can also address a range of issues that support the person to be in better health if and when they decide to access treatment, which can, optimize their chance of reaching their recovery goals as well too. So if someone is in ill health, or maybe they don't have housing, it may be really hard for them to be thinking about entering recovery if they don't have a place to live. So harm reduction can help them with that. Provides them better footing so that they're more able to make that move into recovery as well. The last myth is that harm reduction drains resources from healthcare and treatment services. So harm reduction tools and services are relatively inexpensive, and they're also cost effective. They increase social and financial efficacy in reducing the transmission of infectious diseases at a lower cost, rather than waiting to treat complications at more advanced stages of the illness, which is going to come in at a higher cost. So it's actually a low cost, cost savings philosophy in treatment. So just kind of wrapping up this really brief conversation about harm reduction is, it leads to safer use, moderation, or abstinence, depending on the individual's desires and needs. Because the focus is on improving the quality of life, any step that reduces harm to individuals, their loved ones, their community, and society is embraced and celebrated. Again, celebrating any positive change where that person's kind of driving and an active participant in that change as well. So that's kind of what I prepared for you guys. I just wanted to, since I had you all together, is just pull forward from Overdose Lifeline. We have naloxone and fentanyl test strips kind of fall into our harm reduction activities at our organization surrounding the opioid overdose crisis. So I just wanted to call out that on our website, anyone in the state of Indiana, through a grant with the state of Indiana, Overdose Lifeline provides free naloxone kits or Narcan kits and fentanyl test strips. Someone can come to our website and make that request, and it gets mailed to them. We also have a lookup where they can look up a local community partner that can provide naloxone and test strips. And they can also look up locations for nalox boxes, which provides free naloxone that's accessible 24 hours a day at an outside location that there's no personal interaction needed. So it allows individuals to be able to freely access that. So I just wanted to call that out since I had you all together. And then here is my contact information. And I apologize if I'm forcing you to learn how to spell my crazy name, but you can always just reach out to anyone at Overdose Lifeline, and they'll find me if you're interested in that free course that I mentioned as well. So that's what I have for you guys today. Thank you. I'll stop sharing too.
Thank you very much, Courtney. Travis, would you like to take it away?
No, that's tough to follow. We are very fortunate that we have 2 of your nalox boxes. I want to say in 5 of our counties we have boxes, and Blackford will be our 6th. It's just up in the air. Jay County has 2. I really wanted to talk about the person in recovery side of harm reduction. I'll be in recovery 4 years in June. I oversee 22 counties and work in 12 in Indiana. And this is a huge problem with, you would think, only the supporters. But unfortunately, harm reduction is frowned upon even in the recovery community, to the extent of I do meetings at a inpatient treatment center, and at least once a week I have to address that it is part of his recovery to be on medicated assisted treatment. That is harm reduction. You have to support it. You know, I literally say things like, if you don't have anything nice to say, don't say anything. You know, I smoke cigarettes. I now smoke ultralights. I used to smoke full flavors. And when my mom's on me, I'm like, harm reduction, mother. I'm working on it. I'm trying. As a peer recovery coach, I know I have individuals who attend a meeting every week, meet with me every week, and yet they are smoking pot, and their family really struggles with that. And I'm like, he's not shooting dope. Ultimately, I really butt heads with people when they say, well, what's your statistics? I'm like, well, they're alive. That's our goal here, is keep people alive. You know, in doing that, advocating for harm reduction, I do remind them it is illegal, so I can't okay it. But if that's part of your recovery plan, I will support it. So I know a lot of people struggle with, well, he's still drinking and or smoking. I promote that as harm reduction. It's funny you mentioned the 4 stages, because with pre-contemplation, from our role here at the coalition, that would be usually like an overdose. We're part of a quick response team. We'll go visit them, and they're at pre-contemplation, and I give them Narcan. I give them a business card. You know, I give them support and meeting schedule. And normally at contemplation is when we implement something that is more harm reduction. I've literally had the conversation with people of, you have to go to treatment Monday. How much dope do you have? I have 2 grams. How much do you normally use? I'd use 1 gram a day. Okay, well, we have 3 days. Can you use just enough to not get sick, but not get high? And I've had people say, what are you doing? You know, I've had cops say, oh, that guy promotes drug use. I'm like, no, I promote keeping people alive. And I've been through heroin withdrawal. And I wish somebody would have said, just use enough to where you don't get sick, so that we can get you into treatment in the next 48 hours. I would much rather answer any questions, but I do appreciate being invited to this, because embarrassingly, like I said, I had no idea that so many people in active recovery do not promote harm reduction. There are organizations out there that abstinence is the only way. And it's just, there's not a handbook to hand out here and say, hey, you should be on page 2 now. You know, let's keep moving your recovery plan. So I'm very grateful that Courtney mentioned how you'll bounce back and forth along that scale, because it happens all the time. And that's where people like Jody and I come in and say, it's your recovery. I'm here to support that. And in doing that, I will eventually get your support system to accept that. And that's the challenging, but the most rewarding part of this job also.
Thank you, Travis. And thank you, Courtney. This is great information for everyone today. And I'm going to ask if any of the ICJI people are here and want to turn it over for some updates, and then we'll round it out with some questions after that.
I don't think they're here.
I was looking to see.
I don't see anyone.
I don't think they must not have any updates today. So.
Okay, no update for that. Well, then we're just going to open it up for questions, and we definitely would love to have everybody engaged in some conversations for Courtney and or Travis or both. Feel free to jump in and ask some questions. Or is there maybe some in the chat or?
Looks like Chase has his hand raised. You
I see a
can go
hand
ahead and
raised.
unmute or put it in the chat, whichever you prefer, Chase.
Sure. So, hi, Courtney. It's good to see you. I know it's been a minute. I'm the president of the Hendricks County Substance Abuse Task Force, and I serve as the community director here at the Willow Center in Brownsburg. I'm a former educator with ODL's This Is Not About Drugs education program, which I really love. I have more of a question as someone who's just not a person in recovery, but who is, a recovery advocate. And I suppose it's more of a cultural question for either Courtney or Travis. Is it possible to be an ally within the harm reduction community for certain portions of what harm reduction stands for, or is it sort of an all or nothing expectation? Or does that just kind of boil down to case by case? Because I could imagine especially the more conservative agencies that might be part of this coalition who are all about naloxone, but maybe they struggle with some of the like cannabis replacement therapies and things like that. And perhaps it's a process, maybe we'll get there in a few years, who knows? But yeah, that's my question. Is it all or nothing, or can you still be an ally and sort of be choosy on which pieces you support and don't?
Yeah, so great question, Chase. I'll just step back to my own personal path here. Much like you said, it was very easy for me to sync up with, naloxone, keep them alive, right? But I really had a lot of confusion surrounding like the syringe service program. And then as I moved along, I kept my little mind open, and I started, meeting more and more people that work in harm reduction and learning. And so now I understand, syringe service programs has a lot of positive benefit for the community, for the individual. And then it's really, really so powerful to understand that that person is connecting up and re-engaging socially, and how that shortens usually their pathway into recovery as well. And so my personal recommendation is, so yes, absolutely, you can be supportive of harm reduction and have questions or not have 100% agreement with all aspects of it. But I just encourage you to keep your mind open to it, and open yourself up also to be engaging with individuals and listen to how people are benefiting from it. In time, it's kind of like, do I jump into that cold water that I know is -5 degrees, or do I just tip my toe into it and then learn along the way? So that's my personal recommendation.
Appreciate this question, Chase. I think of it more along the lines when I'm working with the justice system. They have a job to do. And I tell any individual I'm working with, if you test positive for marijuana, you'll probably get violated. But it has gotten so better by me being consistent, honest, and respectful. I always use the same analogy. If I have a cheat day, does that mean my whole workout isn't worth a darn? I advocate so bad that I cannot commend the 12 counties. Like about 8 of them are super great at saying, we don't even care that he's got marijuana in his system. He's alive and he's not putting a needle of heroin in his arm. But eventually, you've got to tell him, the prosecutor's going to care. So it's gotten better, and a lot of it's gotten to educating and knowing what you're talking about and explaining to them that, they have no support. And I know I'm going off of my peer coaching hat, but it really just comes down to making sure that they feel excellent, that they're not putting a needle in their arm. Or if they are, they're putting less heroin in the needle. So it's gotten better. But 2.5 years ago, it was really hard. It was really hard to say, how am I going to work with a justice system that doesn't want to acknowledge harm reduction? And unfortunately, there's some people that they're uneducated and they believe what they read on Facebook, what harm reduction is. I personally struggled with my family, one of my family members posting crack pipe memes on Facebook. And I'm like, I do this for a living. I've never handed out a crack pipe. If you have a question, ask me, but this is how false narrative gets pushed out there. So I'm not only an advocate for something, because we don't hand out clean needles, but we do hand out the whole kit other than the needle. But I know some organizations do give out a syringe. But it's like, just ask, and I always combat with all the things they utilize on a daily basis that is harm reduction, that they don't identify that as, or seat belts. I'm bald. I have to wear a hat in the sun. Doesn't mean I'm not going to get burnt, but it'll help reduce that. And when you just have a professional and respectful conversation, it's obvious afterwards whether you can sway them, but don't let them know. Just be consistent, and eventually they'll show that they're unwilling to change. So yeah, it's gotten better. And to answer your question, I don't think you have to pick and choose what harm reduction you support. I just put it under a blanket statement. and it's a case-by-case basis.
Thank you both for your perspective. Appreciate it.
Krista is,
if you'd like to unmute or post your question in the chat,
yes.
go ahead.
This is Krista Detzel. I'm the coordinator for the Hendricks County Substance Abuse Task Force, so I work very closely with Chase. But a couple of things. My career. Sorry if you hear my cat screaming in the background, but I've actually worked as a therapist in the treatment community. Started in the early '90s, and I so appreciate these presentations that continue to remind me, sadly, there were moments, certain organizations that I worked with, there were moments that I thought, oh my gosh, they're getting it. We're breaking down silos and everything else. And now it's 30 years later and we're still struggling with even that. I was so happy when ICJI opened up and changed to behavioral, so that because I've always been a huge proponent that it's the whole person. It's not just the active per se, the active addiction. Obviously, we know there's comorbidity and all of those things. What I wanted to share, I'm not sure, I think I have a question at the end of this, but one of the things I wanted to share was my struggle professionally when MAT hit really, really big. And we had one of our local doctors who does a tremendous amount of MAT in his practice and works closely with our drug court system. Education was key. And that's the sad part to me, is that I keep trying to figure out how do we get more people to hear and read or understand the true purpose of MAT and why the person being still alive is way more important than that black-white thinking of abstinence. But having been around for so long, certainly that's all I heard, inpatient, outpatient, whatever, when I first started in the field. So I do just want to encourage anyone that really struggles after hearing that presentation, even though I had been in the field, even though I had preached not necessarily what I believed. I always was able to meet the person where they were, but I still had doubts in my head. Am I doing the right thing? Is this okay to support them even though they're still using? And that education about medicated assisted treatment was just really, really brought me to full acceptance and understanding. And so I just want to really encourage any counties, any LCCs that have a practicing physician who, we just happen to have, he's just outstanding. But if you happen to know a doctor and can get them to either connect with our doctor or whatever to kind of spread from that perspective, I think that's really, really helpful. I think one of my questions really for Travis is so much is happening with the fentanyl, people ordering pills online or getting pills that they think are going to be safe, how are you addressing that aspect of, well, but I've been using this, maybe even in the past, prescribed medication that has been very helpful, has kept me off of heroin, but then they're like, but I can't get it here, and they're looking to get it somewhere else. I assume it's just education again, but that just scares the bejesus out of me in terms of the fentanyl being introduced that way, as a mixer, as a byproduct. So I was just curious how you handle that as a peer facilitator and or a peer professional, and just in your support.
That's
I'm
a
done.
tough one.
Yeah.
I fortunately have not had to deal with that yet. It did make me, when you were talking about it, it made me think of, and I know this is an unpopular opinion. So when I started this role 2.5 years ago, I went and visited another RCO, and they talked about this underground Subutex ring they have and how on board they were with it. And after meeting with them and talking to the people doing this, not the organization, but like the community was just kind of selling and buying Subutex, abusing them. But they were like, they can't get insurance. And I'm kind of going off script here in the sense of like, I've never dealt with what you asked, but I know that the only thing I have dealt with is people taking Suboxone or Subutex without a prescription and being very careful that it's like, I can't advocate for it because it's illegal. But I also, this is your recovery plan. I support your recovery. So it's kind of a gray area because you got to be very careful on what you say. And that's where the recovery coach in me comes in to say, well, why aren't you getting your own prescription? Oh, you need a license to get insurance? Okay, well, let's do all those things. Oh, you need transportation? We can help with those things. So, I'm very careful at how I word it, but my goal is, okay, you have identified a barrier, whether you meet it or not, and I can help remove that barrier by getting you to take care of all the necessary steps so that you can get your own prescription. So I know I didn't answer your question, but I'm fortunate, honestly, that I haven't had that happen yet.
No, that's great, Travis, and I appreciate it. And I do understand the whole the building blocks, and that we have to get that foundation because that's what they're missing, right? They're missing some basic needs. They're not getting needs met, and that's what probably started this whole thing, either through a different mental health issue or the usage itself. So thank you so much. Appreciate your time today.
Thank you, Krista, for those good questions. And let's go up to Chris or Diane. Diana, and I'm not sure who had their hand up first, but feel free to jump in with your question.
Yeah, my name's Chris. It's more of a comment, like kind of what Chase was talking about. I know I started this peer recovery coach specialist job at Mental Health America here in the Wabash Valley region back in December. And I remember during my interview, they asked me about harm reduction. And I personally have been, substance free when it comes to substance use for over 14 years. And I remember rolling my eyes kind of because it had been programmed into me that once you ingest that in your system, school is out. And that kind of mentality with the obsession and compulsion and disease profile. But I would like to, I'm grateful for everybody who is on this platform that is doing the work they're doing. And by keeping an open mind, we're saving people's lives. Congratulations, Travis, on what you're doing. I have harm reduction methods of my own. And I think that was a great analogy. And I think that's a great way to open up people's minds when they think about quitting smoking and whatnot. And even in my own personal recovery, even though I've been met with some opposition at times, and I'm grateful that I did grow up during the HIV epidemic. So I've always been a needle supporter, even if my complete abstinence was off the chain at one time. The idea that we can save people's lives. And if I think about when I first entered into recovery, according to the model back in 1995, even though I didn't get clean until 2007, if there is a such thing as clean. If I would have just had somebody to talk to, if I would have just had somebody who believed in me, I was a crackhead. If they would have had a pill for crack in 1995, I would have took it because I just hated me so much. But to have somebody who believes in you, and even in the 12-step model that I follow in my personal recovery, that only requirement being a desire. That means I need to love you and care for you and support you right where you're at. rather than focusing on maybe some of the other stuff. So I don't know, I had to jump on the soapbox and introduce myself because it was the first time I'd be being on here. And thank you guys for lighting a fire in me, and we'll go from there. Thank you.
Thank you, Chris. That's great. Welcome. Please come back. Diana?
Hi. As Travis said about Courtney, and Courtney helped us get our coalition up and going. I love Courtney. Travis, I really enjoyed what you said. That's how our coalition wants to operate. And Chris, following after you, right? I love your testimonial. That is fantastic. I love hearing that with our coalition when people share with us, when we go out into the community, and some of our partners and members too. It's fabulous. And I'm real excited about this harm reduction presentation today. I think it's very needed. And our coalition is really working hard now. We're heading into this is our 4th year. We're really looking heavily into the harm reduction, especially since CDC and prevention are looking at it in the prevention area now, right? It's being accepted, like our DFC funding didn't accept it before, but now they're looking at harm reduction. It can be part of it. And we're wanting to do it, but our community is very, like, the stigma is so huge. And I don't know, Courtney, I haven't got to talk to you in quite a while, really miss you. And Travis, I don't know, how do you open that door in your community? We're doing the medicine take back. We've now got it where we're working with the Marion County Public Health Department to take syringes back, but not exchange, of course, take back. And we're doing a lot of things like that. But the comments we get when I talk to people about naloxone, well, if they overdose, they deserve to die. You hear, there's all these comments that's just awful. And it's from a non-educated viewpoint, right? When you try to educate, like you had said, Travis, sometimes you just got to know when it's receptive or not, right? When they're listening and they're going to be receptive to it. But I don't know, how do you really go about changing that perspective of a community when it's so ingrained toward the harm reduction? Because I've been about harm reduction before I ever even got involved in this and knew what the terms harm reduction meant, right? Birth control, anything that, the needle exchange, like Chris said, before I even knew what it was about, I saw the benefit of it to the community overall for the health benefit. So I don't know, any feedback on how we can approach that to really open up the minds of people?
So this is going to come off arrogant, and I don't mean it to, but I am a huge believer that people in recovery are the best people to advocate for this. I know every person in this group is smarter and more educated than me, but I know by me going to the local sheriff and saying, do you know where I was at almost 4 years ago? I'm very fortunate I've never been Narcan. We also do the medical thing, and we have a syringe drop box here in our community. But I think that, and in doing that, not only going to community leaders and advocating, and like I said, I tell all my employees, like, whether you're wearing a Jay County Drug Prevention Coalition shirt or not, pretend like you are, because you not only represent a coalition, you represent every person in recovery. And that even comes down to, if you want to flip somebody off because they cut you off, like, don't, do like I did, tint your windows where they can't see you yelling at them. I don't care, but don't portray the coalition in a certain way. Don't portray people in recovery a certain way. So I think it's just being consistent, but I also believe, unfortunately, and I insinuated or alluded to it a little bit ago, like there is and I'm sorry, Chris mentioned it, there's a stigma in even the recovery community. And so we have to approach those organizations that preach and look down upon people who don't provide abstinence as the only pathway to recovery, and getting them to change because unfortunately, I'll just be blunt, harm reduction is going to be the biggest battle we ever face, other than the actual epidemic we're facing. These anonymous meetings have been around for 100 years, and every person in their family has somebody who has a knowledge of it. So if we can get them to understand that harm reduction is okay, they might be the people that can bridge that gap to the higher ups in our community to accept harm reduction. That's just my opinion.
Thank you, Travis. I
Yeah,
think this
Travis,
is-
if I could
Oh.
just layer on top of that, I think Travis, the power of the person in recovery sharing their perspective is so important. And I think we all have, I've heard multiple times that it's the stigma, it's education, and partnering up with communities that are already doing some of this work and broadening maybe who they're reaching out and educating, So, a group that asks to learn about naloxone is going to also learn about the lacing of other street drugs with fentanyl. And that's going to open up their awareness to, oh, this could happen to someone that's misusing a ADHD drug or misusing something that isn't as glamorously dramatic as heroin, right? And so I think it's broadening, working with people that are already doing this work, have that education, and then just saying we're going to work on expanding the knowledge, and that's going to be accomplished in this manner, right? We're going to educate in this manner, but it has to have that human to human connection. So lean on that power from the recovery community or the organizations that are doing that work.
Thank you, Courtney. I think that's just a great opportunity. Like Courtney said, is just teaming up with other, coalitions, the LCCs in your area. I did put in the chat, just teaming up with the regional recovery hub in your area. If you're not familiar with what that is or who that is, you can go on to the IndianaRecoveryNetwork.org. You can actually find the map that's hanging on Travis's wall behind you to see what is the hub in your area, and then you can connect with those regional or those recovery community organizations. And there are peer recovery coaches just like Travis throughout the state. There's 20 different hubs, and you can lean on them for some education pieces, stigma reduction, and just learn some more that way. And also reaching out to Courtney, the Overdose Lifeline. They do great work across the state. So feel free to, just get some more information from, that team effort approach, which we all know is helpful. Is there any other questions that anyone has, or as we're kind of winding down our time? Got a few more minutes here if we want to open it up. All right. Well, thank you everyone for joining us today. Our next meeting will be next month on April the 28th, and our topic is community assessments. We are also always looking for suggestions for topics. If you have something that you would like to talk about, if you would like to be a presenter, please reach out to myself or Katie or Kimbra, and we can add you to our agenda as we move forward. So thanks again, everyone. This has been a great conversation. The more conversations like this just helps to educate us all, and I know that's how we all learn and grow and offer better services in our area. So thank you again.